And we are joined almost every week at least, by some amazing people to talk about different aspects of women's sexual health and really bring awareness and also a lot of facts to this area, which, there's not been a lot of in the past. So today we're going to keep that theme going with a really popular topic, which is birth control and sex, because a lot of people prefer to have contraception to prevent pregnancy in order to have sex, but how does that affect the sex that we have? So I think it's going to be an awesome conversation. We have an amazing fellow physician and founder, Dr. Sophia Yen, who's going to join us for this. And we're going to break it all down and we'll find out about what she does, what her passion is, and how it all relates. So let me get her. Hey, how's it going?
Good. How are you?
Doing great. Good to see you this afternoon. Everybody, this is Dr. Sophia Yen. She is the founder of Pandia Health. And I'm going to let you just tell us all about your background and how and why you get to do what you love every day.
Thank you. I think it's such a delight to have two doctor CEOs and founders call.
That's amazing. I know there's not very many of us, I don't think.
Yes, we are special. So Pandia Health is the only women-founded and women-led, the only doctor-led birth control delivery company. And we're building the online health brand women can trust with their chronic long-term women's health kind of needs, with telemedicine and pharmacy under one roof. I started the company for myself, so I don't ever have to run to the pharmacy, ever have to suffer what I call pill anxiety, which is running out of your pills, worrying about running in the pharmacy. And I have two daughters, 12 and 15. So as they grow and they want to make #periods optional, I want to be there to make sure they get the best possible care. And I'm heading towards menopause. So all my friends are like, menopause, menopause, menopause.
Yeah.
Evidence-based, science-backed, what's safe, what's best for you. And that's what we at Pandia Health are for: expert care by expert doctors.
Oh, I love it. So good. Amazing. Well, something you said we have to dig into a little more because it makes me happy to hear as a gynecologist. So what is this about #periods optional? Tell me more about that.
Yes. So I think I gave a TEDx talk. So if people go to pandiahealth.com/periods optional or Google Dr. Sophia Yen periods optional, you'll find the talk. And it goes over the science and safety that you don't have to bleed every single month. That is so 1990s. We now in 2022 have the technology to make #periods optional. And you can use the implant, you can use the IUD with hormone, you can use the shot, though I don't like the shot as much because munchies and bone density, but anything's better than pregnancy when you don't want to be pregnant. And you can use the pill, the patch, and the ring for all of that. And it's actually unnatural what we're doing. We're now bleeding 350 to 400 times in our lives. And as my OB-GYN professor at UCSF said, the natural state of a female animal is pregnant or exclusively breastfeeding. And how many periods you have pregnant? None.
Yeah, that's such a good point. I need to watch your TEDx talk because, whenever particularly younger women are coming into the office to talk about birth control, there's so much concern about having a period. And, there's a lot of well, won't it all back up and all this kind of stuff, a lot of misconceptions about needing to have a period every month. And so I think it's as a woman, those are the options that I choose for sure. You know what I mean? Because it's why would we necessarily want to be having a period? So I love that that's part of y'all's message. Congratulations on that one. That's amazing.
Well, as a tiger mom in Silicon Valley, I'm like, is your daughter going to do better bleeding or not bleeding? Because my daughter won't be bleeding anywhere near her SAT, her finals, her marching band practice, and sports. As I just saw the Olympics and all the women that were in the Olympics, I was like, how many of those women were bleeding? Because if I was their coach,
Yeah, it wouldn't be happening if Sophia was the team doc, for sure. That's amazing. Okay, awesome. So, what I really want to do today, because I know that so many people have questions about how, like, first of all, what contraceptive options are available, maybe what are the pros and cons of some, and then also how can we think about the relationship of those contraceptives to sexual health. So, does that seem like a good plan to you?
That sounds like a lot of fun. I love
Okay.
talk birth control and have to do another pitch. I think I'm the only CEO you're going to find with a uterus necklace, a
Oh,
beaver ring, and a condom bag.
oh my gosh, that is hilarious. A beaver ring. I have not seen one of those. I have seen lots of like clitori and uteri jewelry, but never a beaver ring, Sophia. That's amazing.
Words because it's MIT.
Yeah,
So,
I love it. It's amazing. Well, good. Okay, so just a brief overview of like what are the contraceptive options. So if someone's like, I want birth control, what are the options? Like how do we counsel our
yeah.
patients about those like
So
different
also,
categories?
the new paradigm in birth control counseling, and you know this, but some docs that have been out in practice may not have kept up with it, is you start with the best and you work your way down. And so if we're talking the very best birth control beats vasectomy and tubal ligation is the
Yeah.
implant. It just blows my mind that something is sticking your arm and it can last for 3 years. And like I like to say, my 12-year-old could put it in. It's that easy to put in.
Yeah, it
Not
is
saying
pretty
your
easy to
12
fit
year
in.
old, but it's
Yeah, the
easy.
12-year-old probably can't take it out, but she could probably put it in.
Yes. And that works better than vasectomy. If you're in the market for vasectomy, do the vasectomy, and then comes the IUD with hormone. Beats tubal ligation. That tells you how crazy fertile some women are. That if you can do
Mhm.
snip, snip, burn, tie, and they still get pregnant, that's just
Yeah.
crazy. But that the IUD with hormone beats that. So these two, we call them long-acting reversible contraceptives, beat tubal ligation, which is like permanent in women, very hard to reverse, but you can get around it if you harvest eggs, blah, blah, blah. And then comes the shot, the ring, the patch, the pill, and then, condoms and fertility awareness method. Abstinence, as I like to say, is 100% effective if you can practice it, but they've shown those who take virginity pledges end up pregnant, end up having more sexually transmitted infections than those who didn't take virginity pledges. So I think always use, I would suggest, something hormonal plus condoms. And the other thing, as a feminist, I recommend condoms as a uterine bearing person because I don't want to leak semen for the next 24 hours. And if my partner had to leak my fluids for 24 hours, he would definitely make sure that I wore something to keep my fluids to myself.
Yeah. Absolutely. And it's important to know that when we're talking about methods of contraception outside of condoms, that they don't prevent sexually transmitted infections. So if we want to prevent pregnancy and sexually transmitted infections, we probably, like you said, need to choose something that's, we're designed for contraception and plus condoms to prevent those from swapping of fluids, not only for convenience sake, but also to decrease risk of STIs like HIV, herpes, syphilis, gonorrhea, all of those that we see very often in the office. So I think that's
And
always a great
warts.
recommendation. Warts, yeah, gosh, those are super common for sure, which can be prevented by the HPV vaccination. While we're on the topic, HPV, so in terms of abnormal pap smear HPV and genital wart HPV, can be really near eradicated if we could get all of our sons and daughters vaccinated for HPV. So I, as a physician, highly recommend the HPV vaccine. What about you, Sophia?
Oh, absolutely. As a
Yeah.
pediatrician, you could start it as young as, I believe, 8 or 9, but we generally do it at 12. But you definitely want to get it in before people start having sex. And the statistics in the US of A, not some third world country, 10% of high school freshmen have had sex. So you got to hit them before they have sex.
Early, that's right. And you can't necessarily do it too early. It's not as if you do it, when they're 11 and then they don't have sex until they're 18. There's not a problem.
It doesn't wear off. It's
Exactly.
long.
Exactly. Amazing. Okay. So then let's talk about the types of different birth control and why. It's so funny because I literally was just answering all these questions for an article this morning. So I feel like I did the prep for all of our IG live like this morning. Literally. But so tell me how, women might think, okay, well, if I choose this type of contraception, these are the different outcomes it might have on my life. So can just in terms of a category, maybe, can you talk a little bit about how, in addition to preventing pregnancy, what other maybe side effects or even added benefits can some forms of contraception have?
Yeah, so I think it's so important for people to realize that there's like 8 different progesterones on there, and
Yeah.
each person has a different response to progesterone. And particularly with the birth control pill, that if you don't like one, there's 39 different other ones that you could try. And even if you're on this progesterone, there's either one with a third higher dose or a third lower dose, and that can like totally change things.
The game. Yeah.
Some of them have what I call more manly effects, so androgenic effects, and that has to do with libido. And so if you know your libido's down, ask for one with a higher androgenicity. The thing is, it's a balance. So comes the libido zits. So it's zits and horny, or less zits and less horny. And so when people say, how does this affect my sex life and libido? Part of libido is how you feel about yourself. And if I have a giant North Star, I'm not feeling so sexy,
Yeah, for
and
sure.
About getting pregnant, I'm not feeling so sexy. But if I know with condoms and the pill, patch, ring, IUD, implant, shot, all those methods, I have like very little chance of getting pregnant, then I can go and have fun with wild abandon and not be like, am I going to get pregnant? Am I going to get pregnant? Am I going to get pregnant? If, back in the day when I was just using condoms and spermicide, if the condom pops, if the condom slips off, I'm literally screwed. But if I got condoms plus the implant, which beats everything, or the IUD with hormone, or the pill patch ring, whatever, then the chance is very low and I can enjoy sex a lot more. The other thing is like spontaneity, right? Like if you're using a condom, but you have to think of every single time, but you can make it part of the foreplay. Like when you put the condom on, then you're good to go. That is time. The diaphragm is what it is and doesn't work that well. It's barely better than spermicide alone, but it is there and better than nothing. And for those who can't use hormones, and the ring, I've heard that 1 in 10 of those with penises feel it, but only 1 in 10 it bothers them enough to take it out. So I wonder if that like adds to the thing. There's something in there.
For sure. Yeah, I think there are lots of partners who can feel it, but it's not like a thing. That's what I've heard definitely in practice. And then one that I've been asked about a ton lately is that I'd love to hear your take on is the lactic acid gel, which is going by the name Phexxi. Have you had any experience with that?
I looked at the research, and the problem is it's not much better than your standard spermicide. It's not a spermicide in that it technically doesn't kill the sperm, but it makes it more difficult for the sperm to pass because it's acid. And the negative is that if you have a history of UTI, which a lot of people in their sexually active years do, they recommend it. And part of that is, but let's educate our readers and listeners that your urethra, the pee hole, is right above your vagina. And if you're like adding lube or you're really wet and then you throw a gel on top of that, then it gets fucked up and you get a urinary tract infection. So that's why we always recommend pee as soon as you possibly can.
Yes.
Have sex. And so the Phexxi also cannot be used with the vaginal ring because it'll eat into the ring. And then the crazy part is just the price. It's like $200 for like 12 doses, and you have to use it every single time you have sex. And I remember back in the day, younger, 3 to 4 times a night. So like, that's $50 a pop.
Yeah, that definitely adds up. I think one thing that I'm excited about to see all of a sudden, it feels like in the last maybe 5 years, are that there are just more options for us to prevent pregnancy. I think that is really a big step in the right direction in women's health and in just the field of contraception generally, is that not only do we just have one, dose, one pill available to us, but we now have some choice. And while that can be a little bit more confusing and requires more counseling and more education, I think from like a feminist perspective, that choice is what it's all about. So what's your take on like the options that are currently available?
Yeah, no, I am so excited about the new things, but there is still so much further to go, right?
Totally. It
There's
hasn't been addressed in, millennia. So here we
yeah,
are.
yes, the IUD only has one hormone. I'd like to see it with a different hormone. The 1 year ring I thought was going to crush the IUD, but the 13 micrograms of estrogen is only good for those who are 30 and above. I'm an adolescent medicine specialist, and
Right.
we don't recommend less than 30 micrograms until you're 30 years old. And then the other one, I just would like to see more variety of rings. I'd like a ring that has at least 30 micrograms of estrogen. Even the standard Nuva ring doesn't have that.
Yeah.
And the shot, there should be other options that don't give you the munchies, you know.
Right.
I love the fact that there are options. And people are like, what about, contraception for men? And I'm like, sure, but then you don't, I'm a control freak and I like the option of hashtag periods optional. But also, do you trust the guy who's gonna end up pregnant? You're gonna end up pregnant.
Yeah, and I think you're right. And there is some data to suggest that like younger men are more open to these contraceptive options, but I think it's going to take a long time until society as a whole is comfortable like putting that into the hands of, of our heterosexual like male partners. So I just feel like maybe we're headed in the right direction with that, but it's going to take a lot of work, and we're all probably going to be gone by the time that actually happens, in my opinion. I might be a little bit of a pessimist on this topic, but that's just
Well,
how I feel.
also with every ejaculation, it's 250 million sperm. And
Yeah.
you need to take that down to less than 10,000, or, as we teach said, just one sperm. Just takes one
Right. That's
sperm.
all it takes. Absolutely. That's a big challenge for anything, for sure. Okay,
250
so we
million.
talked about, oh, what'd you say?
250 million. That's the
Yeah.
population of the US.
That's insane, and also like so fascinating as a science geek. Okay, so another thing that we have sort of glazed over, but I love as a topic, is especially even for adolescent medicine, but for adult women as well, is that sometimes we prescribe birth control for non-contraceptive reasons, right? Sometimes we're on hormone pills. I used to tell my like younger patients in their teens who would come in with their parents who were nervous about starting quote unquote birth control. I'm like, we need to rebrand birth control. We need to call it like something else entirely, because there are so many other potential benefits and so many other reasons that you might choose to take it other than prevention of pregnancy. So other than hashtag periods optional, what are some reasons that people might choose to take birth control that don't have to do with preventing pregnancy?
Also in the adolescent medicine realm, right? Acne.
Yeah.
I used
Yeah.
to always get one zit every month, North Star, giant here, giant here, giant here. And once I went on the birth control pill, didn't have the up and down every
Right.
single month of those hormones and got rid of that acne. Some people have PMS, PMDD. And if you get rid of the M, which is menstruation, then you get rid of that problem.
Right.
Another to make hashtag periods optional is if you can maintain a stable hormone level, that's really good for asthma, arthritis, diabetes, seizure disorders. Psychiatrists have even said they don't like their hormones going up and down in their teenage patients, particularly a lot of drama, and they're already trying to deal with, other things, so much drama as a teenager, adding hormones up and down and zits and random blood hitting you 1 week out of 4 is just better to kind of calm things down. But I always advocate, and it's really important, I call it a Pandia PSA, that if you are missing school or work, please see a doctor. Like
For
one in
sure.
10, every single time I give a talk is like, oh, I'm missing school, I'm missing work, and it's like, if you're missing school or work, please see a doctor, because just because your family doesn't mean it has to be. And the example I give is my family is blind as bats, but I have contact lenses, glasses, LASIK. I'm not running around bumping into walls.
Yeah.
Or some people have asthma. They take their asthma meds so they can breathe and not die and play sports. So
Right. Absolutely. And I think that's so important, just from like the PSA perspective is like, if you're having debilitatingly painful periods, like 100%, or if you're bleeding so much that you can't go in public, or you're having to wear multiple layers of protection, there are ways to help with that. And that's definitely worth a visit with your physician, your provider, whomever's taking care of you, because that's no way to live. And there are so many women who are living like that every day. And the reason is because we don't talk about this stuff, because we've normalized it, because we don't want to whine or complain or cause problems. But all of those things are treatable, and you definitely don't have to be living in pain or bleeding through multiple layers of tampons and pads and stuff like that. It makes me just more mad at, the state of the world and women's health today when I hear that kind of stuff.
Yeah, no, I think we as women, exactly as you have said, had sucked it up for
Yeah,
far too long. And we need to make it clear what we have to go through to bear babies and to be the ones that have the womb and give birth and life in this world. Every single month, random blood, 1 week out of 4. And we don't
right.
have that. And don't be afraid to tell your doctor. Write down your concerns, write down your things. That's the person you definitely should not be all quiet about. Write everything
Right.
out and make sure your concerns are addressed, and know that, again, just because it runs your family doesn't mean it has to be. If you're missing school or work, don't do that.
Not okay. Yeah, absolutely. Okay, so what are some, like, let's talk about birth control and sex, what everyone came here to talk about. So when you think about the different categories of birth control, how do you think about them in terms of sexual side effects or how they relate to sexual function?
I think number one is, how often do I have to think about it? Right.
Yeah,
And do I have to think about it right before sex? And so diaphragm, condom, spermicide, Phexi, all those you got to think about, sponge, right before around sex. Whereas the other ones is just a totally separate thing to prevent pregnancy if and when you have sex. So again, always recommend condoms for STI and for not messing up your vaginal flora
right.
and not having to leak sperm.
Big deal. Vaginal flora, big deal.
Yes, I did some of the seminal research, haha, on bacterial vaginosis in virgins, because we had data on all these women recruits that were virgins and non-virgins that they all pap smeared back in the day before they learned you didn't have to pap smear virgins. So we found, bacterial vaginosis happens. It's no big deal unless you have a history of premature babies, but it is inconvenient, and it
Right.
happens when you throw sperm or a foreign body or whatever brought it on is going to bring it on again. So if you find
Right.
every sex you get bacterial vaginosis, use a condom, and that might help things out. So with respect to the, side effects, I look at, like, libido, I think, is a huge thing,
Mhm.
right? And if it's a progesterone only, then I think you're more likely to have libido than something that has estrogen and progesterone. And so the progesterone only are the progesterone only pill, but the joke on that one, we say you have to take it at the same time every single day. And if it's
Yeah.
hours late, then we call you mom or pregnant.
Yeah.
So,
Which is,
but
I mean, I could never take something at the same time every day. That would never happen ever in my life. I don't know about other people, and I'm pretty organized. That would not happen. I'm sorry.
they give that to breastfeeding women who, like, life is
Right.
night and day. Who knows what time it is? You can't even pee, can't even shower.
Exactly.
You're watching the baby. But there is a new one called Slind, but crazy expensive. And make sure you drink the water, you'll get headaches, I think. But there is a progesterone only options of the implant, the IUD with hormone, the shots. But again, don't like the munchies or the bone density of the shot. But again, anything better than pregnant. And then with the pills, you can turn up the androgen effect, which is the libido, but comes with it zits. But each person is different, so you just gotta, play with it. And having
Right.
a doctor who's written a ton of birth control, and that's why at Candia Health, I've personally written 2,000 birth control prescriptions in 2 years and looked at the side effects by age, BMI, and race, and realizing that, well, we were all taught in med school works fine for a Caucasian female that wants to bleed every month. But for everybody else, after studying the androgenicity and the progestational effect, found a better one with fewer side effects. So if your doctor writes a ton of birth control and understands the different effects of androgens, go. But if your doctor writes birth control like once a week or, once a month, then maybe find somebody who knows how to play with that.
Right. Yes. And it is all an experience, situation, as is everything in medicine. But sort of the more you do, the more you know. Absolutely. And that's why we call it practice. But so let's chat for just a minute because we don't have very much longer left, but on how you approach like low dose pills versus regular dose pills and who you think is better for each of those categories.
Yes. So, adolescent medicine at Stanford and pediatric endocrinology at Stanford and Stanford pediatric adolescent gynecology does not recommend less than 30 micrograms of estrogen if you're going to be taking the pill. Because with a 20 microgram, they've noticed lower bone density. And the people in Pittsburgh or Pennsylvania like to argue with us. And they're like, well, we don't know the long term effects. And I was like, if it were me, my daughter, I don't want anything that has lower bone density than someone else who does not have lower bone density. Just kind of
Right.
like me, but whatever. So we don't recommend less than 30 micrograms. And every time I give a talk to a bunch of I give talks to sororities, I give talks to her campus, I give talks to anybody who wants to talk. So hit me up. As long as
Yeah.
we get, I'm happy to talk to you. They'll pull out their pills and they'll be like, "Ooh, I'm on 20 micrograms." And you can be on 20 micrograms if you're strong, heavy boned kind of person. But again, better safe than sorry. And then you can be on 20 micrograms, I found, with the smaller, really skinny, kind of pseudo anorexic women, because the higher dose is a little high for them. It gives them nausea. But my tip
Gotcha.
is take it right before you go to bed. I've only had 2 patients in my entire history prescription wake up at night with nausea from the pill, and these were scrawnier kind of women. And then the other one is take it with your largest meal of the day. Those
Got
are
it.
on avoiding nausea.
Okay, perfect. Yeah, and I think the like take home here is that, and this is what I always ask, like, what or people ask, what's your favorite birth control? And it's like, well, honestly, there's not one, right? I mean, there might be a favorite one for me, Lindsay, personally, but there's not a favorite one for like women across the world, everywhere, because it depends on so many factors that are specific to who you are, to what your goals are, both short term and long term, what medical issues are going on with you, what's your history with contraception. There's so many things to think through, and that's why it's so important, like you said, to have someone who knows what they're doing with this stuff, who knows the right questions to ask, who knows all of the really intricate parts about contraception. It's not just like a go to the drugstore and pick out your own. Although I'm not against over-the-counter birth control, but we really need to have the systems in place to support women with these really important decisions. So we could have a whole other IG live on over-the-counter birth control. I'm sure we could talk through that.
Yeah.
Um,
No, on the but it's the two that aren't the greatest. One is progesterone only pill, which,
yeah,
as I said, you have to take at the same time every day, or if you're 3 hours late, you need emergency contraception. And then
right,
the other one is a 20 micrograms. So we talked about bone density and at least 30 micrograms, and it's levonorgestrel, which is one of the old school,
right,
progesterones. Has more of the manly effects, which is good for libido, but maybe bad for zits. But each person
right.
is different, so.
Each person's different. That's the biggest takeaway from this. So just really quickly wanted to let everybody know that, just tell us a little bit more about Pandia and how it can support anybody who's watching today.
Thank you.
Yeah.
So the whole point of Pandia Health is we bring expert care by expert doctors to wherever you have internet and a mailbox, and specifically birth control. We're about to launch acne and eventually menopause, but right now focus is birth control. We can deliver to all 50 states. So if you have a prescription,
Amazing.
tell us where it's at, give us your insurance, we bill it, ship it, set it and forget it, never run out of birth control on our watch to the best of our ability. And then if you need an online doctor consult, we can do that in 14 states, which covers about 52% of the US population. So California, Florida, Texas. And I like to promote birth control tourism. So if you're not in one of the 14 states, happen to be going to South by Southwest or
Yeah.
Vegas or any of the Disneys, you can fill out a questionnaire, pay us $20, give us a self-reported blood pressure, and our doctor look at it, write it, and then we can ship it to all 50 states. So
Amazing.
yeah.
That is so exciting. Well, congratulations on everything that you've built, everything that you're doing for women and our, options for contraception. I know you're making it so much more accessible in a really responsible and evidence-based way. So thanks for all your work, Sophia. It's so good to have you here and see you today.
Thank you so much for having us and sharing us with your community and what you're building about, positive sexual health for everybody who wants it.
That's right. Yay. Okay. Well, we'll take over the world now, all of us together. Thanks so much, Sophia. Have a good rest of your day. Bye.
Bye.